So good morning friends, this is Manoj Sharma, welcome to PD classes. Today I am going to discuss with you what CAPF interviewers are asking right now from students. So these questions may be helpful to you as my students have got selected in CAPF and we have also shown good results in AMC also. We maintain your privacy, even we make you prepare regarding your online classes, and these classes are face-to-face, one-to-one classes. So we respect your privacy, doctors. Now comes a very important aspect that what is going on in CAPF interview. Now the first question, very first question, they asked about their introduction. They have asked about tell me about yourself. Then my student has answered and he answered very well, and from that question only, or I can say in the middle of that question, they asked about the city. Later on they come on medical questions. They have shown on projector the picture of mumps and asked from the student that what is this, and he has answered very well. Sir, this is mumps. Okay, tell something about, and like this. And they asked about rickets. Then they asked about osteomalacia, and there were almost 10 interviewers. Among that, one was lady, 9 gents, and they continuously asked questions. There was assistant director general also there, and 2 DIG were also there. And as my student has reached there, he just knocked the door, took permission, he entered and shut door by himself. While reaching, please remember that you should not look at the interviewer. He wished them and said, good morning, sir. And they said, yes, please have your seat. And when he sat down, he told, yes, mister, introduce yourself. In this manner, the interview has started. Now comes another questions which are being asked. They asked about some general knowledge questions. And they asked about the war between Russia and Ukraine. They asked about the India's stand, like what you are in favor of India's stand or not, whatever India has done till yet on war. Next question they asked about the veto powers. And important question which they asked about the UN Security Council members, these 5 permanent members, students, they asked about the name. So you must be knowing these are China, France, the Soviet Union, the United States, the United Kingdom. And students, these are also called Big 5 or P5 also they are called. So if you know very well, then these are the questions which were asked. Then they asked about the acute mountain sickness. This question was also asked. As my students have given an interview, so I asked one question from them that what about the chair? Was it a revolving chair or a simple chair? He said, sir, simple chair, but there were handles. I told, okay, that's comfortable John for us. And he said that all members were sitting in U shape. And I was allowed to sit quite far from them. It means they will be able to see you from foot to your head. It is very important for us students, because once we know, we will come to know that yes, our whole body language will be shown to them. So it is very necessary for us to maintain the body posture over there. So when you know that yes sir, interviewer will look all our body languages and they will notice these things, you will be very careful. Okay. Now comes the other questions which they have asked. They have asked about Archimedes principles. They have asked some personal questions like they asked that why do you want to join CAPF? Why should we select you? These are the questions which are quite personal, and all students are having their own answers, because we can't make fixed answer for all this. As I stated very well in my previous videos that introduction also there can't be a fixed formula that you can apply and you can place these 4 things and you can tell your introduction. Not at all. Every student has its own introduction. Now comes the important part which I want to teach you. As my student who has gone there, he was the first member and he reached in interview chamber almost at 9:30, and when he reached there, he was allowed to come inside. There was no peon, nobody who will take you inside and who will allow you, yes, please come in. No, nobody is there. You have to open your door, you have to enter, you have to wish them, or you at that time you should take permission. And then you enter. It's your duty that you should shut the door, you should walk confidently, take your seat, and before taking you must wish them. And the wishing also, you know, for male and female, only this way. Good morning sir, good morning madam. That is enough. It's not that you are supposed to wish everybody. It's not compulsory. They asked about CBC, platelets, scurvy, rickets, and as I told you, Archimedes principle from physics I can say. And they asked about mumps, rickets, which I have told you through projector they have shown. It means they would be having projector also, and they would show you the type of disease or inflammation. At that time you must know that whether it is pharyngitis, tonsillitis, or related to urinary tract infections, whatever the infections are there or inflammations are there. Now comes the important part that is very interesting, that there were 45 members called on that day and 20 members have only reached. which shows that there are more chances for these 20 members. So among these 20 members, 8 members have got selected. It's a good news. And students, one more thing which I want to tell you, that while sitting, please remember that you must be confident to look each and every member, even while answering. Suppose ADG, Assistant Director General, is asking any question, because he started taking the interview from the person, and when he started asking you question, even if they asked, yes, introduce yourself, then it is your humble duty to look at every member, respect at every member, and try to involve them in your introduction. And as my student is trying to say something, they asked in question in between that tell about your city also. Okay, then he started telling about his city. Then comes some scientific parts and all this, as they asked about the very interesting question about mountain sickness. In this they asked about acute mountain sickness. What is that? So you must be knowing, student, that we are preparing our students online as well as offline, and lot many students have got selected in AMC, and this time it's a good news for us that our CAPF students are getting selected. Right now also our 2 students have got selected till today. So I believe within this month I think would be continued, because in April also my students are having their interviews. So I believe in this month itself, out of my students, at least I believe 80% of my students will definitely crack, but I pray to God for 100% students. And one thing I would like to tell you, that if you want selection, please remember your confidence counts. If you show your confidence over there, and if you don't know anything, please respect that and say directly, sorry sir, I don't know the answer of this question. No problem at all. And if it's not that interviewer will tell you the answer, but somehow if suppose they would tell you, or say they may help you, this is this or whatever the things, at that time it's your duty again, you must say them, thank you sir, thank you for updating my knowledge. One interesting question which was asked from one of my doctor was, tell me, they asked, interviewer asked from him, tell me one resource which India has but no other country is having. So he was in dilemma that what to speak. In this manner, I think maybe you may be having students the best answer I can say, but he stated, sir, the youth of India. They smiled at each other and they said, okay, and they stated nothing. They would ask you some personal questions also, that they can ask you, why do you want to join CAPF? Tell me the qualities which CAPF doctor or medical officer must have. Why should we select you? Only because there are lot many members waiting outside. So these questions also, these are HR based questions, you must know, as current affair questions are being generally asked. So we should read newspaper daily. The similarity which I have seen in AMC and CAPF are that, as usual, there are members in front of them and they are asking both type of questions, HR as well as medical portions. So I believe students, whether you are preparing for AMC, whether it is CAPF, always remember you must have your HR based questions, and these HR based questions are not fixed. It's not that. Whatever in your life has happened or how you have passed your life, related to these only, they will ask you questions. Other than that, regarding medical portion, yes, they have the power, they can ask you any question, they can ask you dosage forms. Like in AMC, many of my students were asked about the doses, they asked about osteoarthritis, rheumatoid arthritis, dog bite, snake bite, and out of these 20 members, those who have gone for an interview, 8 members got selected. They were told about the other procedures like medical and all this. Now students, what we learn out of these things, हमने क्या सीखा, that is very important. So always remember that if you are going for CAPF interview, always try to give lot many mock interviews, so which will make you confident. Prepare the best introduction, and regarding your personal questions, always remember you have your own questions. So it's not that other questions, other people question, HR based questions will be asked from you. It's not that. They can even ask from some of my students, they asked about the strengths and weaknesses. So they can ask any question. It depends on your interviewer's interest and choice. So always remember that you must be very confident in answering, whether it is a medical portion question or it's a HR based question. Now I remember one question was asked from one of my AMC student, that he was asked that you like to work in team or you like to work alone. So what answer we should give? If suppose he give an answer, sir, I like to work alone, it shows what? He is little bit selfish. Sir, I like to work in team. It shows that you are little bit dependent. So always interviewer have a ball in his hand. So at that moment you must remember that you must be diplomatic in answering such questions. So now come on the tips which I want to give you. First is be confident. You can develop your confidence by giving many mock interviews. Try to give your mock interviews, as many you can. or you can practice with us. You can even avail our online classes. Other than that, you should practice body language. That is very necessary. Try to speak in front of others as much before giving an interview. Tell your friends even, yes, please ask questions, medical, HR based questions, whatever questions. Try to answer all these questions and check that whether I am able to speak continuously, whether I am able to speak fluently, I am having enough knowledge to speak or to cover my HR based questions. Regarding medical portion, you must study hard in this particular time. It is very necessary. Now comes on another aspect, you must read newspaper for your GK, and as in newspaper these questions are being very common. And regarding, see, if you are going for CAPF, you are going for even AMC, you must know some security based questions. So I hope student this session was very interesting for you, and I believe that whatever questions in your brain or you want to ask anything from me, please write in the comment box. I am ready to help you, and always remember that I have made for doctors 2 channels, PD classes and interview guide. On both my channels, you will find lot many doctor related videos like AMC interviews, CAPF interviews on both channels. So I believe you will definitely study free from our both channels, and hope that you would be enjoying also our channel. And any question if you or any doubt if you are having in your brain, please ask in comment box. I am ready to answer you. Thank you friends. Thank you so much.